Welcome to the Epilepsy Foundation's Dare to Go the Distance, Taking the Epilepsy Journey. My name's Patty Osborne Schaefer, Associate Editor and Community Manager for Epilepsy.com. I'm also a clinical nurse specialist at an epilepsy center in Boston. I'm joined today by Dr. Nathan Fountain and Sandy Dewar, our experts in talking about the epilepsy journey. I'd like to pose some questions so we can just kind of go back and forth and try to talk about, some of the key issues of the epilepsy journey. So Dr. Fountain, I'd like to start with you. Tell us how common is in epilepsy and can it be treated easily?
How easy is it to treat depends exactly as you said in your introduction. It depends on particular variables for each individual. But if we talk in broad terms, about half of people with epilepsy who have recurrent seizures then will be really well controlled easily by the first medicine they try. Seemingly almost any seizure medicine that's tried up front first will seem to control their seizures. For the other half of people, there's about half of them, so that means about 25% or a quarter of the whole, who will eventually get good seizure control with additional medicine trials. And that means that about 25 or 30%, so maybe a fourth or maybe a third of people with epilepsy will continue to have seizures despite our best efforts, at least at the time being. So that means that for those people, they're still in the middle of their journey for control of their seizures.
So then my next question I'm going to direct to Sandy is that if seizure medicines are not working, are there other ways or avenues that a person can explore?
Yes, I think I would just like to add to what Nathan had said about seizure control, and to say that many people will respond well to medicines, and for those who don't, there are a range of medicines that can be considered. I think that it's very important for people to confirm that they have a good and correct diagnosis of epilepsy before considering other options. Having said that, very often patients start on medicines and end up in a tunnel of trying multiple medicines one after the other, having brief periods of control and then unfortunately losing that control and being offered additional medicine trials. And the downside of that is that time slips away and people lose many years to uncontrolled seizures before they are referred to a specialist in epilepsy. So, I think that starting out on the journey, one needs to be aware of what to expect, if possible. And certainly to know that if medicines don't work, if the first one or two medicines do not work, that is the time that patients should be referred at the least to a neurologist and at best to an epilepsy center where the problem can be more comprehensively addressed.
So that's a great point, is that people first need to be aware that if they're not controlled with the first one or two drugs, it's time to take that next step on the journey. Dr. Fountain, if you were counseling a person with epilepsy or family about the steps of an epilepsy journey, what would that first point that you want the patient or family to know about?
The most important place to start, just as we just talked about, is with seeing a neurologist. So for a lot of people, I think that's not such a big step. They have seizures, they go see their family physician or their primary care provider, who refers them to a neurologist. So I think that first step is frequent. There are people who are not diagnosed with seizures till late, and that's kind of its own problem. But in general, I think most people, particularly the people likely watching this, they recognize they have seizures. So they've already made that step. The second step is probably self-evident, then, for the neurologist to start a medication and give it a try. The third step's probably yet another medication. So if the patient came to me as an epilepsy specialist and said, what's my next step? I'm visiting from out of town and I see them at a cocktail party and they say, what's the next step? I have seizures and my general neurologist isn't doing the trick. Then certainly I'd agree exactly with what Sandy said, is to refer them to see an epilepsy center. And there's a number of reasons for that. But the most important sort of big reason, the overarching theme, is that an epilepsy center, they can certainly try more medicines. They can also provide other counseling or help in other ways besides medicines. And if the medicines aren't working, they could be considered for other treatments like surgery or devices or diet or other considerations.
Thank you for joining us for this section of Dare to Go the Distance, Taking the Epilepsy Journey. For more information, visit epilepsy.com.